Hello, good day everyone. It's another day and another learning. This is Group 2, our virtual presentation entitled Stop Breathing and Heart Attack. And before we formally start into our formal presentation, I would like to introduce to you first the members of the Group 2. I would like first to introduce myself. I am Dandel Mark Almagsanay, and together with my co-members, Felix Balbes, Crystal Ann Lauganas, Gabriel Cayetano, and Princess Joy Gohitia. At the end of this virtual discussion, the viewers or students may able to understand the definition of stop breathing and a heart attack, organizing the causes of stop breathing and heart attack, and finally, adapting the ways on how to prevent and provide a first aid when experiencing these two health problems.
Hi, I am Princess Joy M. Gohetia, Bachelor of Secondary Education, major in Physical Education, second year. Our topic is all about stop breathing and heart attack. We have an apnea. Is the medical term used to describe slow or stop breathing. Apnea can affect people of all ages, and the cause depends on the type of apnea you have. We have type of apnea, stop breathing and heart attack. What is stop breathing? Apnea usually occurs while you're sleeping. That is the reason it's often called sleep apnea. Usually, sleep apnea is curable with medication, nighttime breathing support, and lifestyle changes. Occasionally, surgery is needed. Usually, ang reason sa magka-apnea, ang apnea man good is about kanang mag-sleep ka na nawala lang palit imong ginhawa or naglisod ka og ginhawa. Mao siya is disorder na siya na kung asa ang paghinga sa katao or nawala siya sa pagtulog. Kasagaran sa maka-encounter of apnea is kanang mga tabaon, kanang mga high blood, muna sila kasagang ginayan. Untreated apnea can lead to heart and brain problems due to a lack of oxygen. Yes. Medyo na siya ang magka-apnea ka kanang kulang ka ug makakuha ka og hangin. Like, abo ng mga tabaon, lisod kina sila makakuha jud og hangin kay abo na maghigda sila nga nakahayang, di kay na sila makakuha og hangin jud sila hang. Muna siya ang stop breathing. What is a heart attack? Heart attack occurs when the flow of blood to the heart is severely reduced or blocked. The blockage is usually due to a buildup of fat, cholesterol, and other substances in the heart, coronary arteries. Okay. Heart attack is occur when the flow of blood is cholesterol, you have build. Kanang heart attack jud is causes is kanang magka-heart attack ka kanang sagaran siya is sa mga high blood, sana sila sa maka-affect sa heart attack. Like, kanang hilig og kinaon sa mga chicken skin, maka-gain ka og more cholesterol ana sa imuha. And makakuha ko na siya og UTI. Kanang mga high blood, tabaon, kay muna sila maka-conjure sa heart attack. Like for fatty, cholesterol containing deposit build up over time, forming plaques in the heart arteries. If plaque fractures, a blood clot can form. The clot can block arteries, causing a heart attack. During a heart attack, a lack of blood flow causes the tissue and the heart muscle to die. Kanang sa mga high blood, labaw na kanang mga kanang init kaayo, then murag musaka man gud na ilahang dugo, according sa ako ang lola is high blood man siya. Experience siya og high blood, man init mo ano jud iyahang dugo, saka na makagkuan siya og kanang murag mabisig siya og ginawa or makadumos siya sa iyang heart, manay makakuan jud siya sa heart attack. Isa pa sa and kanang ano siya ang stop breathing in the heart attack.
Good day, everyone. My name is Felix Sasakan Balbes, and I'm here to introduce or to explain some of the causes or most of the causes of stop breathing or the sleep apnea. So first is the overly relaxed throat or tongue. So it is also known as the throat spasm or the cricopharyngeal spasm. So it describes or has this feeling as though a large object is stuck in your throat, or this can be accompanied by choking or tightening. So this caused by esophageal muscle enlargement, changes in the nerve signaling pathways, scarring of the muscles, radiation, trauma, stroke, or gastroesophageal reflux disease, or also known as GERD. So second one is the enlarged tongue. So sometimes it is called a giant tongue or macroglossia. So what is microglossia? So it is a rare condition that typically affects more children than adults. So most people have microglossia because they have other conditions such as Beckwith-Wiedemann syndrome or Down syndrome. So I know guys na dili kay mo familiar, or most of us are not familiar with Beckwith-Wiedemann syndrome. So what is Beckwith-Wiedemann syndrome? So it is a congenital growth disorder, which means it's present at birth or inborn na siya guys. So BWS have various signs and symptoms, so including a large body size at birth and taller than average height during childhood, and a large tongue, and hypoglycemia or low blood sugar. So the third one is the enlarged tonsils or adenoids. So enlarged tonsils and adenoids are also referred to as tonsillitis. Parang ginatawag na to na, uy, gitonsil ko guys, alam mo na siya. So adenoiditis or tonsil and adenoid hypertrophy. So a child with enlarged tonsils and adenoids may have a sore throat, trouble from swallowing food or any, tapos sleep apnea, or an inner ear infections. So most cases of tonsillitis are caused by viral infections such as the viruses that cause the common cold or flu virus, are also known as influenza. So some cases can also be caused by a bacterial infection, typically a strain of bacteria called group A Streptococcus bacteria. So the fourth one is being overweight. Yes guys, murag mo ni siya ang main cause sa stop breathing jud. So overweight and obesity are defined as abnormal or excessive fat accumulation that presents a risk to health. So a body mass index, so atong BMI over 25 is considered overweight. Tapos kung and over 30 siya, mula pa siya sa 30 is obese na siya guys. So in obese people, the fat deposits in the upper respiratory tract make breathing difficulties. So during sleep, thus causing OSA or the obstructive sleep apnea. So OSA is strongly associated with obesity. So ang OSA, or also known as obstructive sleep apnea, kay common jud siya na makita sa mga obese people or overweight people. So obese people must be screened for OSA. So OSA and disorders that are associated with it. So the fifth cause of sleep apnea is the irregular function of the brain signals that control the throat muscles. So central sleep apnea results when the brain temporarily stops sending signals to the muscles that control breathing. So the condition often occurs in people who have certain medical problems. So ang central sleep apnea kay nag-occur siya sa mga tao na naay medical problems. So for example, it can develop in someone who has a problem with an area of the brain called the brainstem, which controls our breathing. So this condition, ang kaning central sleep apnea is very different from OSA or the obstructive sleep apnea. Kaya ang obstructive sleep apnea, in which breathing stops because the throat muscles relax and block the airway. So most common po siya sa mga obese people and obese people, and because of throat muscle. So central sleep apnea is less common than sleep apnea. So madalas lang kayo ng central sleep apnea. So yeah, so lastly, the last cause of sleep apnea is the shape of your head or sleeping positions, guys. So sleeping on your back can make your sleep apnea worse. So this is because your tongue can fall back towards your throat, or murag matuklod siya palikod and press against your airway. So mablock tong murag dalan sa to ang hangin. So any extra weight or pressure such as body fat, so yeah, obesity, body fat around your air. So during an episode of sleep apnea, a person is unable to breathe sufficiently due to a narrowing of the airway, so which causes them to snore loudly and take a long breaks in between breaths. So sleep apnea is a common condition in which your breathing stops and restarts many times while you sleep. So this can prevent your body from getting enough oxygen. So here are some symptoms of sleep apnea. So first is excessive daytime sleepiness. So kanang murag pag bangon nimo kay murag kapoy na kay murag dili kapoy, like mas wala kay bot kapoy diba. So secondly is loud snoring. Nang kusog kay kamo hagok. And then third is observe episodes of stop breathing during sleep. So fourth is waking during the night and gasping or choking. And then fifth is awakening in the morning with a dry mouth or sore throat. So morning headaches, and lastly trouble focusing during the day. Yes, sleep apnea is a serious problem, guys. So sleep apnea is a dangerous condition because it can cause several different complications. So many of which are severe or life-threatening. So this include heart damage and heart failure. So sleep apnea causes an increase in pressure in the blood vessels and vessels around your heart and on some of the chambers of your heart itself. So sleep apnea severity or varies from person to person. So magdepend siya sa tao. So it's completely normal to experience breathing pauses up to 5 times per hour kung sa adult. And then kung sa children or sa kids, kay dapat 1 per hour lang. Yes. So these are thought to be part of normal sleep. And then, pero it's always best to consult with experts like doctors, guys. And then, as I said earlier, the main cause of sleep apnea is anything that could narrow your airway or naga-block sa imong airway, such as obesity, large tonsils, or changes in your hormone levels can increase your risk of obstructive sleep apnea, or the OSA. And central sleep apnea happens when your brain does not send the signals needed to breathe. So, mo na siya ang difference sa OSA, which is the obstructive sleep apnea, and CSA, or the central sleep apnea. So, how to avoid sleep apnea? So, first is you need to stop from smoking, quit smoking, stop all use of alcohol or sleep medicines, mga sleeping pills, guys. Kay this can relax the muscles in the back of our throat and making it harder for you to breathe. And lastly, lose weight and to sleep on your side instead on your back.
Alright, hello everyone. My name is Crystal and Ganas, and I'm going to report the causes of heart attack. Causes of heart attack, there are many types of causes of heart attack. First is high blood pressure and high cholesterol. Leading cause of heart disease and stroke because it damages the lining of the arteries, making them more susceptible to the buildup of plaque, which narrows the arteries leading to the heart and brain. It means if we have high blood pressure or hypertension, this is when the pressure in your blood vessels is too high. So the measurement for this one is 140 to 90 mmHg, or millimeters of mercury. So it is common, but it can be serious if not be treated. And number 2, we have diabetes. Adults with diabetes are twice as likely to have heart disease or stroke as people who do not have diabetes. We have called like type 2 diabetes. I'm sorry for the background noise, guys. So type 2 diabetes affects how your body uses sugar or glucose for energy. If we have a high sugar, our body, the energy of our body will stop. So it stops the body from the using insulin properly. Insulin is like maintenance for if you have a diabetes, which can lead to high levels of blood sugar if not be treated. Next, we have smoking and secondhand smoke exposure. Smoking is a major cause of heart disease and stroke and causes 1 in every 4 deaths from these conditions. So we all know that smoking can or the major cause of the heart disease. And also the secondhand smoking means that they will inhale the smoke. Like someone who smoking, people exposed to secondhand smoke face the same dangers as smokes themselves. Next is obesity, unhealthy diet, and physical inactivity. Compared to those at a normal weight, people with overweight or obesity are at increased risk of heart disease and stroke, their risk factors. including high blood pressure. So those who have people are obesity or has a unhealthy diet is are defined are defined abnormal or like excessive fat, excessive weight. That is the meaning of obesity. And that will be going to or that will present a risk to health. So if you have seen a person or like a people who has a obesity, you cannot talk to them and respect to them and to ask that you need to take care of your body and has a proper exercise and to do a physical activity every day. That's it. Thank you so much.
Hello, everyone. Good morning. My name is Gabriel Caetano, one of the presenter or the reporter from group number 2. So on this part, we're going to discuss on how we're going to prevent the stop breathing or what we call the apnea and also the heart attacks. So let's go. So first to discuss is how to prevent stop breathing or the apnea. We have 4 ways on how we're going to prevent it. First on the list, we have stop use of alcohol or sleep medicine. This relaxes the muscles and the back of your throat, making it harder for us to breathe. So basically saying when a person is addicted to alcohol, they're gonna experience a withdrawal symptoms and also liver diseases such as hepatitis or liver cirrhosis. And also alcohol can affect our brain structure, both short and long term memory. While the sleep medicine, those are drugs or pills, because if you are having difficulties to sleep, so we are going to take those pills, but we should avoid that because it will stop us from breathing. And also, we have a common treatment, called apnea. It is a continuous positive airway pressure. And this type of treatment, we're going to wear a special mask over to your nose or a mouth or sometimes to your mouth while we are sleeping. Second on the list is if you smoke, quit smoking. This is the hardest thing to do if a person is addicted to smoking. For example, a scenario, my brother is a smoker, so I advise him to stop smoking because it's really dangerous to our health and also it could stop us from breathing. Third on the list is we have if you are overweight, lose weight. So we need to practice or to take those nutritious food or practicing healthy diet and exercise regularly. All right. So last or the fourth on the list is sleep on your side instead on your back. So in this part, we recommend side sleeping because it offers more health benefits such as reducing pressure on the heart and also slight sipping can reduce snoring. How to prevent heart attack? We have 7 ways. And first is don't smoke or use tobacco. As I mentioned it earlier, if we're going to use this or if we're going to use those cigarettes or tobacco, it's really dangerous to our health. And we really need to stop using that. It is because it can lead us to heart attack, so we need to prevent it. Second is get moving or aim at least 30 to 60 minutes of a daily activity. For example, doing some like jogging outside, like playing volleyball, badminton, and also doing Zumba, like the dances, because it can really help us to prevent the heart attack and also we can also achieve a fit and a healthy body. Third on the list is Eat a heart healthy diet. For example, spinach. You also have a salmon, blueberries, strawberries, nuts, and avocado. This type of food can really help us to have a healthy heart so that our brain will gonna be function. Fourth on the list is maintain a healthy diet. So what do you mean by this? So simply saying, like we're going to practice or exercise regularly, like doing some workouts. Because there's also an advantage of that. Like we could have a good shape of our body and also to achieve a healthy weight. Fifth on the list is get quality of sleep. That is the most important ways on how to prevent a heart attack. Some of the adults need to sleep 7 or more hours on a regular basis or on a regular schedule each night for us to have a good and productive day right after. Alright, so we're down to number 6, manage stress. We really need to manage our stress. That is because that is the crucial thing. Like for example, we can travel abroad, we can go to the mall, or things that make us happy, so that we can able to manage our stress and prevent heart attack. Lastly, is get a regular health screening tests. So in this part, or okay, for example, our family, we have a family doctor wherein every month we're going to check our status or our health condition, or if we have this kind of specific illness, like this type of diseases, so that we can able to prevent it. And also, you can able to prevent heart attack because most of our family member has a high blood. So we need to check them regularly, like the blood temperature, their sugar, and also for us to prevent like the cause of death and also the heart attack. So that's it for today's guys. So I hope you learned something from my discussion and thank you.
Hi, it's me again. My name is Nandun Raquel Magsan and I'm going to tackle about what are the possible action with this zoo health problem. And we should start in the stop breathing or the apnea. So in apnea, we have five actions: the weight loss, the position changes while sleeping and sleep aids, the nasal spray and adhesive strip. Fourth, we have the treating the underlying condition, and lastly, the medication changes. So first, when we talk about weight loss, I believe you are familiar with it because if you're doing your healthy lifestyle, this is part of it, diba? Because you know, if you gain so much weight last year and you want to have a sexy body this year, so obviously weight loss is part of it. At least it will be decreasing for some percentage na rin. So, go back to our topic, weight loss. At least 10% decrease in our body weight can significantly improve sleep apnea for people who have excess weight or obesity. Second, the position changes while sleeping and sleep aid items. Sleeping on your back makes sleep apnea more likely to happen. Take note of that. Sleeping on your back makes more apnea more likely to happen. Special support pillows and similar items can help change the position in which you sleep, keeping you off your back so soft tissue doesn't press on your windpipe and block breathing. Third, we have the nasal spray adhesive strips. These over-the-counter products improve breathing by making it easier for air to travel through our noses. While they can't help moderate or severe sleep apnea, at least they can sometimes help snoring and mild sleep apnea. Treating the underlying condition. Treating conditions such as heart failure can often improve central sleep apnea. And lastly, the medication changes. Working with your doctor or our doctor, and take note of this, if you're experiencing this kind of heart issues or this kind of health condition, don't be hesitate to go to your doctor and ask for it why you felt like this. Kaya para naman pod matagaan ka og prescriptions na mga tambal na para pod makaayo pod sa imuhang na-experience karon or sa imuhang mga dinamdamin na nganong naka-experience ka og stop breathing. So, going back, medication changes. Working with your doctor to decrease or stop pain medications may be able to improve or even dissolve central sleep apnea. So these five non-medical treatments or approaches can typically improve obstructive sleep apnea or resolve it. These five non-medical treatment aren't cures, but they can reduce apnea to the point where it stops happening or isn't severe enough to cause symptoms of apnea. Okay, so the next slide, we're talking about the heart attack. So what to do if you or someone else may be having a heart attack? So in this slide, we listed 4 actions. Call 911 or your local emergency number. Second, chew or swallow an aspirin. Third, take nitroglycerin. And fourth, begin CPR if the person is unconscious. So, talking about call 911 or your local medical number or emergency number is that don't ignore the symptoms of heart attack. That is the basis. Don't ignore the symptoms of an heart attack. If you can't get an ambulance or emergency vehicle to come to you, have a neighbor or a friend drive you to the nearest hospital. Drive yourself only if you have no other option, because your condition can be worsened. Driving yourself put you and others at risks. And second, chew and swallow an aspirin while waiting for emergency help. Aspirin help keep your blood from clotting. When taken during a heart attack, it could reduce heart damage. Don't take aspirin if you're allergic to it or have been told your health care provider to never take it. Fourth, take nitroglycerin. Take nitroglycerin if it's prescribed by your doctor. If you think you're having a heart attack and your healthcare provider has previously prescribed this medication or this pill for you, then take it as directly while waiting for an emergency medical help. And begin CPR if a person is unconscious. If the person isn't breathing or you don't find a pulse, begin CPR, keep blood flowing after you call an emergency medical help. Push hard and push on the center of the person's chest in a fairly rapid rhythm, about 100 to 120 compression a minute. So these are the 4 action and things what to do if you or someone else have may experiencing a heart attack. Okay, so that's all for our discussion today. Thank you for giving us your time to listen our reporting or to listen us while reporting. And the next slide, you can see here the references about our research. So you can freely scan those links or these links for you to have more wide understanding about the stop breathing and heart attack. So thank you guys. Have a good day.